Hi, I'm Matt Collins. I'd like to welcome you to Bob Weber Auto Mart on Douglas Avenue here in Racine, across from Douglas Park. We specialize in 1-year-old, low mileage, almost new cars. And if you'd like to stop by and see them, or see them on our website, bobweberautomart.com, we could save you between $5,000 and $10,000 on your next almost new car purchase.
I'm Michael Burke, and this is Money Talks. Hi, today I'm with Dr. Anne-Marie Schmid of, when I get this right, Dr. Schmid's Mobile Veterinary Practice. You're based in Caledonia, actually right in Franksville. And sad topic alert, we're going to be talking about pet euthanasia, but a much better way to do pet euthanasia, I think, and a lot of people think, and that's at-home euthanasia. So, how often does this come up? And this is a rising trend. I wrote a story and interviewed you not too long about it. How often does it come up for you?
I get phone calls daily on
Really?
this, and sometimes several times a day.
Wow.
We do have certain times of the year where it's much heavier, and that's usually around holidays and for our big dogs when the bad weather starts to kick in, because they have problems with their hips.
Oh yeah. Now the latter is pretty easy to understand, but explain what you mean about the holidays.
With the holidays, what tends to happen, unfortunately, is kind of a house cleaning phenomenon. You've got people who are having guests come over, the dog's been incontinent or the cat's been vomiting or whatever, and unfortunately they don't want their guests to see that. And so you end up having a rash of calls with people who want the pets gone prior to the holidays. Following the holidays, you have the opposite effect. You have the animals who were clinically very, very sick that the owners wanted just one more holiday with them, one more Christmas, one more Easter, one more birthday. And those are very hard.
Yeah, yeah. Boy, that puts a damper on your own holidays to have to do a slew of those. Right?
It does, it does.
Yeah. So now, if someone calls you and says, "I'd like to have my pet put down," what are the first things you ask them?
I personally will only euthanize for medical issues. And so if it's a client of mine that I've been working with, I know medically what's going on. If it's somebody that I haven't seen before, they get a bunch of questions. Why are you doing this? What's going on with the pet? And if there is something that we can do to help, if we can try some pain medication, or we can, maybe do some simple testing. We see a lot of cats who have urinary tract infections. We see dogs.
Which is a curable thing.
Yes, you can work with it. So we see lots of different things that are workable, and we just want to make sure that the owners know that there are options for them, that euthanasia is not the final answer if it's a medically treatable condition. And so that's how my practice operates. There are practices that will not ask questions.
Really?
So it just depends on the practice and the personal ethics of the vet. I need to have a medical reason because I take it very seriously.
And I know you told me previously once that you've had people want their pets put down for just ridiculous reasons, right? That happens now and then?
I have heard reasons from, new furniture is actually a big one. I got leather furniture, my cat has its claws, it's shredding the couch. That's actually, I get that several times a month.
Wow.
But the ridiculous ones are the animal doesn't go with the new color scheme. I painted the living room and the dog doesn't look right with it.
Wow.
And I wish I was making that up, but I'm not.
Yeah, boy, that's sad for the pets. Let's get into some of the advantages of this, and some of them would just be, fairly commonsensical, but why don't you start with what you see as the advantages and why people are turning to home euthanasia? Certainly.
Probably the biggest thing is the comfort of the pet. with the exception of the happy Labrador, or dogs that absolutely love riding in the car. Many of these animals, they don't want to come to the vet. They don't want to go in the car. Cats in particular, they hate going in the car. They hate the carrier. And so even before the appointment, they're starting to stress out. They're starting to ramp up, and you've got the anxiety. And by the time you get into the clinic, the animal is totally worked up. Sometimes cats in particular, they'll vomit, they'll release urine, they'll release stool. The dogs are very anxious. And you don't want to remember your pet's last moments as being, terrified. That's not a good thing for you, it's not a good thing for them. So that's the big thing, I think, that people like.
Yeah, and then I think the flip side of that coin is really it's the privacy and the comfort it could afford the owner too. Doing it at home. I mean, going in and exposing your emotions in a vet clinic.
It's a very tough thing. Some of the more progressive veterinary clinics actually have a room set aside for grieving owners, and I really like that. If I ever open my own standalone practice, I'm going to have one of those. But yeah, it is very difficult because many people don't feel comfortable in public showing their emotions.
Yeah.
I've had people apologize to me for crying and getting misty-eyed, and it's like, no, it's okay. This is part of the family. In the home environment, they are allowed to be a little bit more themselves. They are allowed to break down and cry and hug and all those things, and that's a good thing.
And maybe bring in family members who want to be there. One thing that you didn't mention, there's a mosquito in here.
Sorry.
Is the transporting of a very sick and perhaps large dog at the end, right?
That's correct. I get that, and I get the senior citizens who don't drive. Those are the two big transport issues that I tend to see. And again, I mentioned when winter comes. I can't tell you the number of dogs that are over 100 pounds that physically the owners are just unable to get up. They can't stand, they can't lift them. Many of these people don't have cars, don't have people to help them move the dog. If you do move the dog, unfortunately many of these are painful. And so the dog may lash out and try and bite. If a dog bites, legally we can't put them to sleep for 2 weeks. So it's a catch-22.
Yeah, that'd be a real complication. So what's the process like?
Basically what we do with my practice, actually with any practice, the first thing that would happen is we need to make sure that the animal has not bitten anyone in the prior 2 weeks. And that is a state mandated law. It's to look for rabies. So presuming that that's the case, we get the signature, and then what I usually do is an injection of a sedative. The injection typically takes about 5 minutes, depending on the drug combination.
Do you want to show us on Al?
Now, Al, we are obviously not euthanizing today,
right.
but what we'll be doing, this is actually, I'm cheating a little bit. This is his yearly vaccine. He is due, and so we're gonna do the process using the regular vaccine. So in dogs, I'll usually give the injections here in the neck area. In cats, we'll usually use a back leg. And it's just as simple as this. It just goes right under the skin like this, and a quick injection.
Boy, you didn't even flinch.
No, we use a small needle. Most animals basically are going to be fighting the restraint rather than what you're doing. So in his case, he didn't move. Many cases, I'll have my assistant hold, and we'll do the injection.
That's right. We didn't mention that. You do show up with a vet tech.
Yes, I do. I do always have an assistant with me. And that's both so that the owner is not the bad guy, and also basically for safety reasons. If the animal would bite, I'm vaccinated against rabies. You or your actual, your typical person usually is not.
Right.
So it's to work with things like that. But then what would happen is this takes about 5 minutes or so. The animal gets nice and relaxed. Will literally just kind of fall over or lay down in the owner's
unconsciousness.
In what many people will do, I actually brought this just as a demonstration. If you've got like a favorite blanket or pillow or something along those lines, you can just basically let go. You can just put the animal on there. They can get, just kind of cuddled up on their favorite little blanket. And the thing that's nice about that is it's got their scent on it. It's got the scent of the owners. So you're not bringing them into a scary situation. Okay. So then once they're on the blanket or pillow or being held by their owners, I have many people who will just hold the animals. They're going to get nice and relaxed, and typically what we're going to do is we're going to do an injection. The final injection does need to go in a vein. I'm not going to show that today because I don't have my assistant with me, and we're not doing it to him. But typically with a cat, what we'd be doing, he'd be nice and relaxed. We would just go over on our side like this.
Heck, relax.
Yeah. We just go on the side, and we would do the inner thigh here on a cat. On a dog, we'll either do the outer thigh or the front leg. And that just depends.
The typical IV kind of situation.
I try to use the back legs more so that the owners, if they're present, can be right by the head of the pet, talking to them, being there, so that, you know, that's the last thing that the pet sees. And so that's the way that I do things with the euthanasia.
So how do owners, what are the various reactions of people during and after the process?
You know, you've got the whole 9 yards with this. You've got people who are very stoic and just stand there like a soldier and don't shed a tear, don't do anything. You've got people who fling themselves over the body and really, I mean, this is a member of their family, you know, and they are just devastated. And everything in between. So. Yeah.
What about afterward?
With my practice.
Do you hear from people afterward about the process once they have a little bit of distance?
I actually, it's kind of depressing because most of the nicest letters that I get are thank yous for the euthanasia process. They are very grateful that the pet was able to be at home, to be, you know, worked with and not frightened. And it sounds like an awful thing, but it's actually very gentle, and it's a very loving thing for the pets.
Why did you say it's depressing? Some of the nicest letters you get are from...
I would really like to be, you know, hey doc, you saved my dog, you know, it was hit by a car and you brought it back. And yeah, sometimes you hear from those, but you know, this is not a surgical procedure, this is a medical procedure.
Well, that speaks to the emotional experience.
It does. It really does.
Now, before we have to wind up, let's talk just a little bit about, well, first of all, does it, for you as a mobile vet, does it cost more? Well, I guess you only have one way of doing it, right?
Right.
At home. Okay, so there's a,
For my practice, it's, again, worked into the fees, and this is something we do. In general, if you were to take your pet into the clinic, in general, it's going to be a little less expensive because you're going to the vet, and the vet is going to be handling...
pay a trip charge of some kind.
Right. The other thing is that I tend to be a little bit more with the cremation process because I'm transporting the pets to the crematorium and bringing them back to the owners.
Which is the last part I wanted to get into, the options, or is it primarily cremation then as the option?
That's correct. Most of my clients choose cremation. There are some that will bury their pet at home or make their own arrangements directly with the crematorium, and that's owner preference. I do want to go on record as saying in most cases, particularly City of Racine, it is not legal to bury. And so the owners that do that, I don't know what's happening.
Well, speaking of cremation, you have a couple examples.
I do. Everybody has differing needs, and you can have a basic cremation. These are all my own pets from previously, and you can pick out different urns and different things that reflect the personality of the pet and your needs.
They're usually available at the crematorium.
They're available at the crematorium. You can buy them on your own. They sell them online. So, like for instance, this was the first cat that I ever did surgery on. This is Pyrexia, and she's got her photo on here. So that's a laser engraved one. This takes a little bit longer. Something like this would be a little more generic, but it still is pretty. It's got the paw prints. It's got a little thing about Rainbow Bridge on it. Sometimes you have something that you look around and it just doesn't speak to you. Some owners, myself included, will make their own things. This was my first very special cat. This was Kitka, and so she was a princess. Fancy. And she knew it, and so we had this made specifically for her. So you've got everything from very, very simple to very complex.
And of course, you could always do scatter the remains in your garden or whatever.
Exactly. Some people choose to keep the remains. Other people choose to scatter them. One thing that I've got on today, little memorial jewelry. Some people will actually take the ashes and have them made into jewelry bits. So this is actually part of the same cat. And again, she was very dear to me, so there are things that can be done. So.
Well, Dr. Anne-Marie Schmid of Dr. Schmid's Mobile Veterinary Practice, it's a fascinating topic, not the most joyful, uplifting topic, but I think it's fascinating, and what a great option for people who are facing that decision. Thanks a lot for watching, and thanks to our producer, Scott Anderson. Please join us again.